Taoiseach, in the last 24 hours, the government have changed from a risk-based vaccine distribution system to an age-based vaccine distribution system. Last week, you said your vaccination system was based on public health advice. This week, you say your vaccination system is based on public health advice, even though they are mutually exclusive systems. So now a 46-year-old person who's working remotely will be vaccinated on the same day as an SNA who's working with children with special needs, as a Garda who is arresting people in a riot, as a carer on whom a person depends on completely, and on teachers. And the reason being, Taoiseach, and I think it's important to be honest here, the reason being is because the system that you had previously was based on GP lists. It was based on consultants' lists. And as a result, many people were slipping through the cracks. You had people with stage 4 cancer who had been bounced back and forth from GPs to consultants and unable to get their particular vaccines. Now, the reason that lists were used is because there was no central database of patients in the country. Even though you had 6 months to organise a central database, the government didn't get it together. And it's incredible to hear, last week you say that one of the biggest challenges for COVID is people's actions and their mobility, and now you said that's not the case. You said the biggest risk is age, and you're saying that people's professions, i.e. their mobility and their actions, is no longer a sufficient risk for them to be prioritised.
To the points raised by Deputy Tobin, it's not moving from risk to age. Age is risk. That's the point. And again, we can play with language, but the reason that NIAC have decided on age, and they've looked at the reviews, they don't determine huge differences in between occupational categories, but they do unequivocally say the international evidence is now clear that the older you are, the more vulnerable you are to severe illness if you get COVID, and to death if you get COVID. There's no contradiction, as you asserted, between the behavioural issues or how you avoid getting COVID in the first instance.